Okay, this is the CoVidooers submission for the ACS hackathon. We were looking at health facilities management in a crisis. We came up with the idea to use Odoo, which is our company's ERP platform that we use at Finalist Group Will Do IT, which is where our team is from. The problem we were looking at was health facility management in a crisis, and the solution we decided was to develop a simple, accessible, cloud-based health facility management system that can admit patients, put them in rooms and beds, and see if we can manage beds quite simply. The innovation that we're applying is that we're using the Odoo platform. We are wanting it, which can be built quite quickly, and we wanted to demonstrate the power and flexibility of Odoo. We want this system to be cloud-based and that all on the one platform, on the one database, so that multiple facilities can exist within the one database. Obviously, permissions and security would be managed. Each facility would become a company in Odoo. Odoo is multi-company capable. That's actually what broke the software at the last minute, but it does work when you get it sorted out properly. The benefit here is that it could be a central register of beds, patients, and conditions during a crisis, allowing for bed planning and forecasting across facilities within regions. The benefits of doing it this way is the speed of setup. Facilities can be set up really, really quickly using import routine, and the idea is that in the future we would have developed an API to enable existing systems to interact with the central register as well. Odoo has mapping capabilities. We can't show them because it broke, where the facilities could be laid out on a map with how many beds and patients, etc. as well. So that was the concept. Wanted to show you very quickly where we got to. And we'll give you these login details so that you can have a look yourself. So the concept was that we created this thing called the Health Portal within Odoo as an application within Odoo. We've set up various models, patients, health events. So patients are linked to contact records. The patient can have a patient record, which can have a raft of fields. We just put a couple of simple fields on there to show you. The concept we had was that a patient would have these health events, and that each event would have an event type. I can show you what it's meant to look like. Each event would have an event type that would be attached to the patient. You'd have a description of the event, so it might be, suspected COVID-19 case. You could assign practitioners and also assign them a bed. So, or they could be even in a waiting location. So if we go waiting. Could be in a waiting room. If this hospital had a waiting room, this one doesn't. But anyway, we'll just pop them in the bed. And then the idea is that I could press save there and that would actually work. At the moment it doesn't. Throws an error, and that event would be attached to the patient, and there could be multiple events. The most current event spouts what location that patient is in. So it's the bed that they're in. And then there was this bed management tool that we developed. So it shows you via ward and room. The green lets us know that that wing or that room has beds available, and it would show you the patient that was in them, so that you can see which patient's in them, which ones are free, and you could do easy room and bed management across multiple facilities, and that was the power of the system. So there's also the ability to configure medications, and those are also attached to the events. So as you can see here, these ones actually worked. These are some old ones. That this is the doctor. This is the event type was an inpatient, the description, and where they are currently in the waiting room, bed 1, bed 2, etc. So quite a bit of work went into this, 24 to 48 hours, and we have built the bones with a few bugs of a facilities management system. That's the power of Odoo. You can get a system up and running very quickly multi-company, permissions, the whole works, it's all there, and a hospital can be set up very quickly. If I wanted to pop in a whole bunch of new locations, new beds, all I've got to do is import a CSV file of the wards and the beds. It's a very simple formatted file. Hit import, and all those locations would come in. Thank you for looking at our submission, and I hope you see that the potential of the software and of the solution, and that you're impressed by how quickly we were able to get a reasonably functional system working in Odoo. Thank you.